2015, all anyone in the press wanted to talk about was the shocking state of the NHS. The first week of January was dominated by headlines about the NHS crisis, and the papers cried out as one about the injustice being inflicted on the country's most popular and resilient public service. We have a system now struggling to cope with rocketing demand and miserable financial settlement. Most of our hospitals are now in permanent crisis mode, and what is so sickening is how much of this is self-inflicted by this government. They have wasted billions of pounds on reorganisation of the Health and Social Care Act. They got rid of things like the successful life-saving NHS Direct service, and they've allowed the private sector to make a fortune wherever possible from our healthcare service, none of which makes sense for the patient or for the future credibility of the NHS. The grim financial situation faced by the NHS is clearer every day, as is the horrendous squeeze on pay that we, working in the health service, have had to endure since they came into power in 2010. And there is no sign of let-up, as Osborne has said, that any pay awards will be restricted to just 1% across all public service up to 2020. And at the same time, Jeremy Hunt makes a one-off payment of £410,000 to one of his inner circles. For those of us who work in the health service, who put our patients' care at the heart of all we do, feels this is a slap in our face from a government that knows the cost of everything but the value of nothing. Staff morale, recruitment and staff shortage that had put Addenbrooke's Hospital into special measures are inextricably linked, and together they pose a huge risk to patient care. For our NHS to survive and thrive its patients, this government needs to see the wider picture and look after its greatest asset, the staff. All of its staff, from the cleaners, the cooks, those who dispense your medicines, the admin staff who booked your appointments, those who manage the computer systems or pay the bills, and of course, the doctors and the nurses. All of us need your support, and I ask you, please, stand up for the NHS. Thank you.